Did you know that up to 40% of women with blocked fallopian tubes still manage to get pregnant? It's a surprising statistic that challenges the common belief that blocked tubes mean the end of fertility. In this video, we'll explore how this is possible and what options are available. Welcome back to my channel. Today we're diving into a topic that many women struggle with, blocked fallopian tubes, and the impact this condition has on pregnancy. For years, many have believed that once your fallopian tubes are blocked, pregnancy is possible. But is that really the case? Let's explore what happens when your fallopian tubes are blocked, why this happens, and most importantly, if there's still a chance of getting pregnant. Before we get into the specifics, let's quickly refresh our understanding of the female reproductive system. The ovaries release eggs, which travel through the fallopian tubes to the uterus. The fallopian tubes act as a pathway for the eggs to meet sperm, where fertilization occurs. If the tubes are open and healthy, conception is possible. However, if the fallopian tubes are blocked, this creates a major barrier to natural pregnancy. So, why do fallopian tubes become blocked? There are several reasons. Common causes include pelvic inflammatory disease, PID, a serious infection that can cause scarring of the fallopian tubes. Endometriosis, when tissue similar to the uterine lining grows outside the uterus, it can affect the fallopian tubes. Previous surgeries or ectopic pregnancy. Any past surgery involving the reproductive organs can lead to scarring or blockages. Congenital issues. Some women are born with abnormal or blocked tubes. Whatever the cause, a blockage can create a frustrating roadblock for women hoping to conceive. Now here's where things get tricky. There's a common belief that if your fallopian tubes are blocked, there's no hope for natural conception. The tubes are essential for sperm and egg to meet, so when they're blocked, it's assumed that pregnancy is impossible. However, this belief isn't always true. Let's look at how fertility can still be achieved, even with blocked tubes. Blocked fallopian tubes prevent the egg from traveling to the uterus, and they also block sperm from reaching the egg. However, it's important to note that the extent of the blockage plays a significant role. There are two types of blockages: partial blockage. This occurs when the fallopian tubes are partially blocked, which might allow sperm to pass through, but still affect egg and sperm meeting or egg implantation. This can sometimes lead to pregnancy naturally, but it's much less likely. Complete blockage. When the fallopian tubes are completely blocked, natural conception becomes nearly impossible without medical intervention. This is where fertility treatments come into play. Here's the good news. Yes, women can still get pregnant after their fallopian tubes are blocked. While the situation can seem daunting, there are several options available for women to conceive. In vitro fertilization, IVF. IVF is the most effective treatment for women with blocked tubes. It bypasses the fallopian tubes completely by fertilizing the egg outside the body in a lab. The fertilized embryo is then implanted directly into the uterus. IVF success rates vary, but for women with blocked tubes, it is often the most viable option. Surgical options. In some cases, surgery to unblock the tubes might be an option. Procedures like tubal cannulation or laparoscopic surgery can remove blockages. However, the success of these surgeries depends on the extent and location of the blockage. It's also important to note that while these surgeries might restore some fertility, they don't guarantee pregnancy. Natural conception. In some rare cases, partial blockages may allow for natural conception. If the blockage is not severe and the tubes are still functional, pregnancy may still be possible, though this is less common. Let's talk about success stories. Many women with blocked fallopian tubes have gone on to have healthy pregnancies thanks to IVF. In fact, studies have shown that IVF has helped millions of women around the world overcome fertility challenges. There are even stories of women who underwent surgery to unblock their tubes, and after a few attempts, they were able to conceive naturally. When it comes to treatments, IVF is the most common route for women with blocked tubes, but other options include fertility drugs. Medications such as Clomid or gonadotropins can be used to stimulate ovulation and increase the chances of pregnancy. These are often used alongside IVF or surgery. Tubal surgery. For women with partial blockages, surgery to remove the blockage might help. The effectiveness of surgery depends on factors like the location and cause of the blockage. It's essential to have a thorough evaluation by a fertility specialist to determine the best course of action. While fertility treatments like IVF can offer hope, they're not without their side effects. Some potential side effects include ovarian hyperstimulation syndrome or OHSS. This occurs when the ovaries become overstimulated by fertility drugs. Emotional and physical strain. IVF can be physically demanding and emotionally taxing. Hormonal treatments can cause mood swings, bloating, and fatigue. Multiple pregnancies. IVF increases the chances of multiple pregnancies, which come with their own set of risks. It's important to weigh the pros and cons of each treatment option and discuss potential side effects with your doctor. Before deciding on a treatment, there are a few important things to keep in mind. Success rates vary. IVF success rates depend on several factors, including age, the cause of infertility, and the health of the uterus. It's important to have realistic expectations. Health considerations: make sure your overall health is stable before pursuing fertility treatments. Obesity, smoking, and other health conditions can lower the chances of success. Cost and emotional impact. Fertility treatments like IVF can be expensive, and the emotional journey can be challenging. It's important to be prepared for the financial and emotional commitment involved. Be sure to consult a fertility specialist to explore the best treatment plan for your situation. In conclusion, blocked fallopian tubes don't have to mean the end of your fertility journey. While it can present significant challenges, options like IVF, surgery, and fertility medications offer hope for many women. If you're dealing with blocked tubes, don't lose heart. There are multiple paths to pregnancy, and with the right medical support, many women achieve their dream of having a baby. I'd love to hear from you. Have you or someone you know faced challenges with blocked fallopian tubes? Share your experiences in the comments below, and if you want to learn more about fertility myths and truths, be sure to check out my video on common fertility misconceptions. Thanks for watching. Don't forget to like, subscribe, and share this video if you found it helpful. Stay hopeful, and remember, there are always options to explore.